You are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners, I'm Urvashi. Today we will discuss the future of functional neurosurgery with our expert Dr. Gurneet Singh Sahni, who belongs to the new generation of an ultra-modern neurosurgeon in India. He has attained fellowship of functional epilepsy, surgery and neuro-oncology from Japan. Dr. Sahni is acclaimed for his excellent competence in treating complex and critical brain and spinal cord disorders. He is an accomplished and dynamic neurosurgeon with an extensive training in minimally invasive surgery and neurotrauma procedures. With an experience of 14 plus years, Dr. Gurneet Singh has emerged as the most distinguished top neurosurgeon in Mumbai. At present, he is working as a senior consultant and head of neurosurgery department at Fortis Hospital, Mumbai. Hello, Dr. Gurneet. Welcome to our podcast for patients, caregivers, and healthcare professionals at Medica Talk.
Hello, Urvashi. And to all the listeners, hello to everyone. And thank you, Urvashi, for such a introduction. So let us start today's
Sure.
podcast.
So, doctor, can you tell us about the importance of functional neurosurgery?
Okay, now let me tell you first what is functional neurosurgery. Now, functional neurosurgery is a type of subspecialty of neurosurgery. Neurosurgery is a big umbrella, which people usually don't know. Neurosurgery is not related to one topic at all. Neurosurgery has got this functional neurosurgery as one of the parts, neuro-oncology as one of the parts, endovascular or vascular neurosurgery as one of the parts, neurotrauma as one of the parts, spine as one of the parts, skull-based surgery as one of the parts. So there are a lot of sub specialities in this super specialty called neurosurgery, out of which functional neurosurgery is one of the part of it. Now, which functional neurosurgery is where we try to save the function of that part of the brain while we are treating on it. It deals with a lot of features like movement disorders. Movement disorders, generally what we know is about Parkinson's disease. People have this movement, they are not able to move, they are not able to do that. So we have got surgery for Parkinson's disease. There are patients who have got tremors. They cannot write. Their signing is not proper. So this is called essential tremors. We have got surgery for that. There are patients who have got who are musicians. They are not able to play because their hands get tight. So one of the recently there was one of the case which got famous, that while playing the guitar we were operating on a neurosurgeon was operating because his guitar notes he was not able to play properly. So that's called focal dystonia. So that is functional neurosurgery. So treating the function of the patient is functional neurosurgery. Along with that, the tumors which are present at the speech area. Now I am speaking to you because of the speech area of my brain. Now, if there is a
Right.
tumor on that, if there is a tumor which is there, we have to remove the tumor also and save the speech area also. So in that what we do an awake tumor operation, where when I am removing the tumor, the patient is talking to me, okay, while in the operation. So and in that we localize which is the speech area of the brain, and I
Right.
save that area and remove the remaining tumor or the whole tumor depending upon the position.
Okay.
So this is functional neurosurgery. Epilepsy surgery also is a part of functional neurosurgery, where the patients with epilepsy or seizures, convulsions, they are treated by surgical ways so that this epilepsy problem stops and
Okay.
patient becomes hale and hearty. So that is functional neurosurgery.
So what are the advancements in functional neurosurgery?
I told you just now. So advances from functional neurosurgery has started from a basic of we doing something called as a lesioning procedure. That means a procedure where we used to localize one part of the area where there is problem uh, to putting implants there. That's called deep brain stimulation. There is neuro navigation machine, as we have got a navigation machine in our mobile while we are driving the
Right.
similarly we have got a navigation machine which helps us to navigate to the area to find out that area or part of the brain where we have to treat. There is interoperative monitoring which helps us to do all these awake surgeries. uh, there is something called as planning station, where by doing just a keyhole of the operation, just a hole in the skull, and we are able to treat that problem. So these are the advances which have happened in functional neurosurgery.
So in what conditions is functional neurosurgery used as a treatment?
Ah, I told. So there are a lot of conditions where functional neurosurgery is used. First and foremost, Parkinson's disease. Dystonia is where the patient hands and neck. You have seen many people who are neck is like this. They're not able to walk. Their hands are
All right.
turned. So these are the patients where we treat, where they get the treatment with functional neurosurgery. There are patients with tremors, which I told you, essential tremors. There are patients who have got something called as trigeminal neuralgia, or sudden onset of shooting pain on the face. Uh,
Okay.
that is treated with functional neurosurgery. There are some people who have got twitching in the face like that, and that gets treated with functional neurosurgery. The tumors of a very eloquent area of the brain. Eloquent means very, very important area of the brain, like the speech, like hand and leg power, where it is there. That gets treated with functional neurosurgery. Patients who are paralyzed because of hands being tight and all, that gets treated with functional. So there are a lot of patients who there are a lot of indications for functional neurosurgery. Yes,
So
Gurnesh.
what is the procedure of diagnosis?
Okay, so diagnosis of such patients are mainly clinical. Clinical is the patient comes to the OPD, we diagnose that the patient has got Parkinson's disease by asking him the symptoms. And then MRI is one of the major steps that has to be taken. So after we do the MRI of the patient, we come to know exactly if there is a tumor, no tumor, where exactly we have to go. So, so basically, clinical thing and an MRI. Along with that, sometimes we require a DOPA PET scan for Parkinson's disease and the other things. So these are the investigations which are required. That's how the diagnosis is done. Yeah, Rupesh.
What are the treatment procedures of functional neurosurgery?
Hmm. So the treatment procedures are something called as deep brain stimulation, where we put electrodes into a specific part of the brain, which will correct the circuit problem, the circuitry problem which has happened in the brain. So we put that electrodes there, and that is connected to one of the pacemaker kind of a battery which we keep it here. Okay, and when the stimulation starts, the patient becomes better. So,
Okay.
so that is one of the procedures. The other procedures is where we don't put this implant; we directly go inside and radio frequency ablation of that nucleus. The specific nucleus that we have to deal with. The third thing, that is awake tumor excision, is what I told you. and where the operation happens without giving them general anesthesia. Then the other things that are required is that can be done with this is something called as baclofen pumps, spinal cord stimulation. So there are a lot of procedures, microvascular decompression, a lot of procedures that are there in functional neurosurgery. Yes, yes.
What are the advantages of functional neurosurgery?
So the biggest advantage is that the function of that part of the brain is saved. Okay.
Right.
Along with that, all the diseases which we have previously found that has got no cure
Right.
has got cure now.
Okay.
Okay. So this is the biggest advantage of functional neurosurgery. The patients who are severely in pain and have got a lot of trouble, they become better, and normal lifestyle starts on the patients. This is the advantage. Yeah.
Any particular time period that it takes for the procedures to, be completed and for the cure to take place, or is it like it depends from patient to patient?
Yeah, you are correct. It depends upon patient to patient, but some of the procedures take. Uh, so the procedures usually take about 6 to 8 hours
Okay.
for this. So from the time that we have started to the time here, it takes that much time for these procedures to become better. Yes.
Okay. What message would you like to give to our listeners?
So I will tell all our listeners. See, as I am a neurosurgeon and I'm talking to our general public, uh, neurosurgery is a branch which is very much feared by many people. They feel that if there is a problem in the brain, then the patient can never be cured. The patient's life is destroyed, and the patient always will be in coma. But that's not true. The medical science and the surgical techniques have gone to such an extent that patients get cured of problems like brain tumors, like problems of brain hemorrhage, like brain trauma, like movement disorders, like Parkinson's disease, uh, many other things. Of spine, patient becomes better. So now, for just an example, a brain tumor patient, when I operate, the patient goes home in 3 days. Like if today is the operation, the patient goes home a day after tomorrow or a day after that. So that means the patient doesn't need a long-term admission and doesn't need a long-term thing. So patients are so the life of the patient becomes better with such surgery. So don't fear. Have faith in your doctor and trust the doctor, because every doctor will want your good. No doctor wants that the patient should not be good. And then
That's true.
have faith on God. That's the whole thing.
Much needed. Yeah.
Okay.
Thank
Yeah.
Thank you,
Thank you.
doctor, for being a part of
Thank you.
Medica Talk and sharing your insights. We are
Thank
hopeful
you.
that this informative talk has enlightened the listeners about the importance of functional neurosurgery. Thank you so much, sir.
Yes.
Thank you.
Yeah. Okay. Thank you so much. Bye bye.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.